I'm so excited to be running on Sunday. Our station has a couple of teams participating in the marathon relay category. And so I'll be running the last 5 miles of that 26-mile stretch, which is okay with me.
Yeah.
I get to cross the finish line downtown Grand Rapids. It's going to be so much fun.
That's right. We put Rachel at the end, so she's the prettiest one crossing the finish line. Just kidding. Anyway, it's a great event, of course, sponsored by Metro Health, University of Michigan Health Systems, and of course, it's all focused on staying healthy. I recently had the chance to visit the hospital's new stroke center and meet the doctor behind this unique program. Talking about the topic of stroke and specifically what it means if we have a risk for stroke and also if we or somebody we love is presenting with symptoms of stroke. So we're here inside a fantastic room at the Metro Health University of Michigan Health Hospital with Dr. Ravi Shastri. You are a special kind of radiologist. Explain to us exactly what it is that you do and what this room is we're standing inside.
Well, Terry, so I'm a neurointerventional radiologist. What that means is that I'm a specialist in the blood vessels of the brain and spine. And as a part of the acute stroke team, my function is to help remove the clot out of the blood vessels in a patient that would be suffering from what's known as an ischemic stroke. And in those patients, there's a limited time frame in which we can help somebody so that they don't continue to have problems after their hospital stay. There's a limited amount of time that you have before someone's weakness or debilitated state takes hold and they become weak either for the rest of their life or they could potentially die. That time frame has recently been expanded with new technology and new research to 24 hours, which is the gold standard for the treatment of stroke that we're providing here at Metro Health.
And so let's talk about stroke and the intervention that you're able to do here. I mean, really, it is groundbreaking technology that is available right here at Metro Health, University of Michigan Health. That is right on this campus.
In fact, it's right in this room, Terry.
Yeah.
We're able to treat patients that either have brain bleeds related to injuries of the blood vessels of the brain from aneurysms. And what we want to do is give people the best chance of having the most fulfilling life that they can, especially after having such unfortunate luck.
And so we talk about a stroke and we talk about our risk for developing a stroke. There certainly are some indicators that we may be at a higher risk for having a stroke.
At Metro Health, we're starting a Know Your Numbers campaign. This is a campaign to help patients understand their risk related to blood pressure and allow them to connect with primary care doctors that'll help them individualize their care to treat all of these different factors that can cause them to be at higher risk for strokes, heart attacks, blood vessel problems throughout their body.
And so here at Metro, I know a big part of what you do is you really help empower the patient with knowledge and information about really how to take care of themselves the best way possible.
Well, that's true. I think that that's my principal role as a physician, is to help patients with helping themselves. A large percentage of strokes are preventable. And part of that is related to risk factors that they themselves can begin treating even at home. And that's another reason why connecting with both our primary care doctors and having connection to our healthcare system is able to help our patients, our neighbors, to live better lives.
And so here at Metro, I know that you have assembled a team of people so that 24 hours a day, 7 days a week, holidays, weekends, if someone is having an issue, if they suspect that they themselves or someone they love is having a stroke, you're staffed to take care of them immediately with the highest possible care.
That's absolutely correct, Terry. At Metro Health, we have access to some of the best neurosurgeons in the country. We have access to our colleagues in neurology 24/7. We have a neurointensive care unit that's able to take care of the sickest of the sick patients who have strokes and other injuries of the brain and spine. And now the addition to Metro since August is myself and my partner are able to provide this kind of life-saving treatment. All of these pieces to the puzzle have allowed us to increase the level of care here at Metro and allow us to take care of the sickest of the sick patients.
And you recently had a patient, your first patient.
We had, since August, this is our first patient that we were actually able to remove the clot from. This patient came in unable to move one side of their body, unable to focus their gaze, unable to speak to us. And then we were able to get the patient to this room very quickly. Now, the patient was found at home after they had fallen. And when we got them to our emergency room, we were able to quickly identify that the patient had a blocked vessel. We brought them to this room and removed the blockage. And honestly, Terry, 2 days later, they walked out of this hospital.
Unbelievable. That's why you got into medicine in the first place, isn't it?
Absolutely.
That's right. Saving lives, high technology with the most specific care possible. We're here at Metro Health, University of Michigan Health Hospital. You know, such a great story. Dr. Shastri and his team so excited to bring this technology and expertise to University of Michigan Health Metro. Of the 800,000 strokes in the United States each year, an estimated 80% are preventable. So the stroke team does kick into action when somebody arrives at the facility, but with so many of those strokes, prevention is a high priority.
Pretty amazing.
Yeah.
One of the most common risk factors is high blood pressure. So they are launching a campaign at the Grand Rapids Marathon Packet Pickup, which is tomorrow. It's called #KnowYourNumbers.
That's right. They're offering free blood pressure checks that day, and they'll also be doing blood pressure checks at the Metro Health outpatient care centers during the entire month of October. The Know Your Numbers program is designed to empower patients by providing insight into those risk factors and by providing the actual numbers that could put people at a higher risk for developing a stroke. And the Metro Health University of Michigan Hospital, located in Wyoming at M6 and Byron Center Avenue. And you saw me in the piece there. They arranged so I could get my blood pressure done.
Yeah, I was like, how did that go?
That's right. Well, it was a little higher than typical, so I'm going to be heading back to one of those outpatient care centers so that I can double check it, you know, keep me healthy.
Absolutely. That's where we want you to be.
And good luck this weekend.
Hey, thanks a lot. Good luck to all the runners. We'll be right back.